Good morning, good afternoon, good evening, everyone, given where you're joining us from, and welcome to our November 2024 LabCoP Monthly ECHO Session. My name is Francis Ochen, a project manager with African Society for Laboratory Medicine. I'm your moderator for today's session. Our housekeeping rules continue to hold. The session will run for 1 hour. We'll take a shared presentation that get into the questions and answers. Kindly join the discussions through the chat and do not share any personal information in the chat other than questions or counter comments. We already have all the information we need from you that was got during the registration process. We have language interpretation services. Please do keep to either English, French, or Portuguese. Stay away from the off channel. Our session slides will be shared together with the recordings as soon as they become available. Today we convene the third in a series of sessions that are dedicated to optimizing procurement and supply chain. And this series is made possible given our collaboration with the USAID Global Health Supply Chain and the Procurement and Procurement Management Project. In the first session, you may recall, we shared PEPFAR's experience in establishing molecular instrument-based service level agreements with global diagnostic manufacturers for viral load and early infant diagnosis. And of course, by extension, the same approach can be done for other test needs. And then in the second session, we looked at establishing and managing KPIs under the all-inclusive service level agreements with practical insights from Zambia and how to define, handle, and use KPIs in managing suppliers and instrument performance. And so in today's third session in this series, we'll get to yet another very important concept in the procurement and supplies management value chain, the vendor-managed inventory. And in this, we will provide insights into what vendor-managed inventory is and how this is implemented, generally speaking, but also with specific reference to Nigeria. And for the Nigeria case, we'll be highlighting how then countries can develop strategic moves in creating a path towards supply chain operational excellence and efficiency. We are also aware that whether automated or manual, a well-functioning inventory management system really seeks to bring your inventory carrying cost down while ensuring that you have sufficient stock to run your day-to-day needs. And colleagues, to take us through this very exciting piece, we have two presenters and one speaker. Our opening speaker will be Jason Williams, and Jason is the Senior Technical Lab Lead with USAID Global Health Office of HIV and AIDS with the Supply Chain Division at USAID Washington. And then the presenters will include Fadzai Marange, and Fadzai is a Senior Diagnostic Advisor with the Global Health Supply Chain and Procurement and Supplies Management Project. And last but not least, we will have Theophilus, and Theophilus is the Lab and Logistics Director with the Global Health Supply Chain and Procurement and Supplies Management based in Nigeria. Colleagues, join me in welcoming Jason, who will do his introductory speech before we get to the presenters. Jason, over to you.
Thank you so much, Francis, for the intro. So again, as Francis mentioned, my name is Jason Williams. I'm the lab lead on the supply chain team supporting PEPFAR. This is an exciting area, something that we haven't really exposed too much of the lab community in relation to VMI. So I'm hoping that folks can take away a better understanding and appreciation of the concept of VMI. It can be somewhat challenging and complex to establish. There's obviously some country level responsibilities that need to be in play, as well as very close coordination with the manufacturer. I think as Fadzai and Theo go through the presentation, you'll see the benefits, some of the challenges that have been incurred as part of some of the pilots that we're doing. We're not only doing this in Nigeria, but we're also doing it also in Mozambique. So quite a few lessons learned operationally, as well as part of procurement billing and distribution challenges. But we're working through those, and there's a lot of positive aspects to this that I'm hoping that Fadzai and Theo can articulate as part of their discussion. Vendor managed inventory is, like I said, it's relatively new, but it is a central component of the longer term strategy that we have within USAID to simplify and kind of step away a little bit from the traditional sort of supply chain roles that we've historically been involved in. A lot of what we're talking about is actually transitioning a lot of that responsibility that we've had contractors and other implementing partners of ours handle as part of supply chain. And this is a really good opportunity for manufacturers to kind of step more into that space and take a little bit, well, a lot more responsibility actually in regards to stock management, redistribution, and just overall monitoring of consumption to support the programs that we're operating within PEPFAR. So with that, again, I'd like to thank you again for coming to the third session. Hopefully folks that are participating on this call today were available and attended the previous two. And we look forward to doing a few more kind of under the umbrella of all-inclusive agreements, by which VMI is actually an additional service element that would be added to a service level agreement as part of the service offerings that a manufacturer would offer. So with that, again, thank everyone for joining. And hopefully this is going to be a productive presentation. And I'm looking forward to responding to questions in the chat as we kind of go through to alleviate Fadzai and Theo's burden and trying to respond more in real time towards the end. But welcome again, and I'll hand it over to Fadzai to begin the presentation. Thank you.
Thank you very much, Jason, for passing over that stick to me. Good afternoon, everyone. As you have all heard, my name is Fadzai Marange. I work as part of the viral load team for the PSM project. And today I'm going to be taking us through the vendor managed inventory, in which we hope to align and familiarize everybody who wishes to embark on this journey. And what we have seen with VMI is really about driving the efficiency and improving access to viral load testing through this form of strategic procurement. Next slide, please. So vendor managed inventory is a supply chain agreement that occurs between a supplier or a vendor with the customer, who in this case is a buyer, who has responsibility of procurement in a country. And it involves transfer of responsibilities between the supplier and the buyer. This is where the supplier, who was also responsible for the upstream, is now getting further into the downstream in terms of distribution of the inventory. And for some of us, we may not be familiar with the term inventory, which I believe a lot of us are. When we are talking of inventory in this regard, we are talking about HIV viral load and EID, the stock of reagents and commodities that we use in the laboratories to make sure that we deliver on this service. So the objective of this discussion is to make sure that by the end of this presentation, with the example from Nigeria, we have a minimum understanding of what VMI is as a process, and we can comprehend a stepwise process on those who want to embark on a pilot and start implementation in their own countries. Next slide, please. So what is VMI in the first place? I regard it as an innovative process because there is a lot of pluses that come with it, and it makes things easier if implemented correctly. It's an innovation that is PEPFAR has decided to introduce in the future to make sure we improve on supply chain through streamlining of processes and improving efficiencies. And with this, we hope that it is going to give us a better outcome on patient in terms of accessing testing. In our PSM project, we have struck a very good relationship with suppliers through the all service level agreements. And as we have done that, we have seen efficiencies that come with this. And with that, we have then piloted in a couple of countries to do VMI. And this has come with greater control of inventory management. So the VMI, we have witnessed it as a symbiotic relationship that develops between supplier and buyer. And in terms of viral load testing, it still maintains the joint national forecasting based on data that is coming from the inventory management that is more real time. Next slide, please. Therefore, the overall objective of VMI as a process is to ensure that we improve service delivery as far as supply chain is concerned. Further down, I'm going to explain why this needs to happen, because we have had a few challenges in supply chain that has triggered the thought of how do we strategically move to a position where we can improve on services. We also hope that with VMI, we can improve reagents and commodity security by ensuring that we eliminate stockouts or wastage. And with it also comes a level of automation, as suppliers are thriving to increase on efficiency on their offerings. And the long goal term for PEPFAR is to make sure with this support, there are increased and better relationships that come between the governments, which in this case are MOH, the public health laboratories, and they link directly with suppliers. That is improving the public-private sector relationships. Next slide, please. So what exactly are the components? What are the interactions, the relationships that we see in VMI? The first one that we see, because of the improved relationships that happen between suppliers and the buyers, is transparency in data, in inventory levels, feeding back, requesting proof of delivery. There is quite a lot of processes that are involved in that communication that ensure that transparency is encouraged, and there is clarity of how stock is being ordered. We have seen elimination of emergence orders, because as you see, as we go forward, there is storage of stock in country by the suppliers, and we have normally a warehouse in the country where stock is kept and laboratories will order as required. And because of the data that is available, the buyer is also an option through all-inclusive service agreements to be monitoring the market, to be following KPIs and seeing if this is the best supplier that they have, if they're getting the best services. And you are able to also still monitor your shipping and delivery, and how you can cover your restocking needs. But above all else, the cost management element is also one which is critical. And on our part, it's a journey that we are yet to embark on, because it is good to see if there's a benefit of moving into VMI by doing a cost analysis. Next slide, please. So why VMI in the first place? What is it that could benefit the country if they decided to move on VMI? So we look at what is the current status quo of countries and what is going through supply chain at the moment. There is quite a lot of challenges. There are errors that are involved, and this comes usually from poor data. And when the errors occur, you are either going to overorder or underorder, sometimes leading to stockouts, sometimes leading to overstocking, which we know may lead to expiry. And it can be quite a labor-intensive process for lab staff as scientists or technologists keep up with doing their routine work and doing inventory management. But we hope to see, therefore, an improvement data. So with the automation that it comes with, cumulative data that is then fed into the national quantification and becomes more accurate in forecasting and supply planning. We hope to see a reduction in overstocking and understocking. That means we don't see any stockouts and we don't see expiries. And we also hope that with automation will come some less labor intense processes, and with transfer of this responsibility, we save time on those staff that were supposed to be working on inventory management, and they do more productive work towards patient care. Next slide, please. So overall, we see an advantage that comes with VMI, which is the simplicity and efficiency that it achieves. So some examples have already been given: reduced stockouts, reduction in carrying costs. I think most of us know that carrying inventory in the lab for 6 months to 9 months is a heavy process, because that space either needs to be rented or created. That space that is now reduced to 2 to 4 months of inventory is a good thing, because that space can be used for other things, because the supplier is stocking majority of that inventory. And also there is also reduction for need for safety stock, because you don't have to do emergency orders because the supplier is right next to you. And with that, we see also streamlined processes and the delivery and execution of processes, leading to maybe some cost savings and promote sustainability as far as supply chain ordering and stock management is concerned. Therefore, we think overall VMI enables a better communication and reliability between suppliers and labs and the MOH overall. Next slide, please. But as we go through, you will discover that it doesn't solve all the challenges that a country has when you are doing VMI. There are certain challenges that stay within the supply chain challenges that we need to make sure that we look at separately, because VMI is not going to solve them. For example, all your problems in terms of stockouts will not finish unless you also align on what you are supposed to do. It's not a 10 key solution that you switch on and walk away and say, in our country, we have VMI, so we are all sorted. It also doesn't happen to be a quantification tool, but it does supply you with data that makes sure that you get accurate data to quantify. And when you have challenges with other KPIs in the supply chain, VMI does not come as that solution. But however, as a standalone process, it comes with its own KPIs. Next slide, please. So for a country to qualify for VMI, there are some steps that they need to take. So if you're coming from a country that is not yet doing VMI, criteria are not showing on your radar, it doesn't disqualify you from pursuing VMI. However, you need to ask yourself, is it something that we can work towards so that we can be able to implement VMI? First of all, you need to have an all-inclusive service level agreement. That means you have yourself covered in terms of reagents, consumables, maintenance, and other necessary services. And then you need to at least have had some historical data. And on data, I'm going to jump also to point number 5. With that data, you should be willing to share the data to make sure that that transparency we spoke about as a component of VMI allows forecasting and correction of the processes as you go along, because the further you go along the journey, the more you become accurate and you have a more reliable system. You should also have storage capacity both in the laboratory to keep you 2 to 4 months worth of reagents and consumables, and also the supplier or the distributor should have enough storage to have stock when the labs need it, rather than to have stockouts and wait for customs clearance. In terms of your Incoterms, I'm referring the conditions that the country chooses to have. It will be advisable that, since it's about delivery to the lab, we stick to the D terms. Either of the D terms would be suitable. And the volumes that the country is also testing have got to be sufficient to justify cost and transition. Next slide, please. So in order to get there, there are a few steps that the country needs to take. And I've divided these into 3. First, you need to identify the key stakeholders and communicate with the intention to transition and taking everybody with you. From experience, I believe we have done 2 pilots, and we are redoing Mozambique, because when we started, we didn't know better. We had some stakeholders and some were not present. In Nigeria, we have seen a better example where everybody was engaged from the beginning. You also then need to have to do a feasibility assessment for yourselves and say, do we qualify? And then you need to collaborate. Going back to identification of key stakeholders, we ask ourselves, who are they in the first place? Of course, MOH with a 4 or 5 star in my case, because they own the process, they own the country, and they should lead the process and make sure they are fully engaged rather than leave them behind. And then we need the implementing partners that are responsible for procurement, if there are any, or if there is a primary recipient that is responsible for procurement in the case of sponsors like Global Fund. And in terms of implementing partners that are also responsible for running the labs, as well as a PEPFAR or a Global Fund country representative, part of the TWG overall. In order to assess yourselves, there are a few questions that one has to ask. Does our country qualify at this stage? If not, what are the things we need to work towards to qualify? What is our historical data telling us? Are we efficient or inefficient? Do we have in-country storage? Do we have lab storage? Are we ready? Do we have a supplier that is ready to start on this VMI? Are we on the correct Incoterms? We have seen some suppliers which we are hoping to work with again in Nigeria already transition from certain Incoterms to D-terms in order to prepare for this. And it took about 6 months to do that. So it's nothing impossible. And you ask yourselves, do we need to alter any contracts in the process? And do our volumes justify? When you have answered all those questions as yes, or we can do it, then you move to say, with the correct key stakeholders, shall we start to draft a scope of work? And you make it quite explicit. And because there's a transfer of responsibilities between suppliers as well as the buyers, you need to have a responsibility accountability matrix with standard operating procedures on who is taking over on what and how it has to be done. A level of training for new processes for those that are involved may be required. And with that, you also engage on performance management through KPIs that are defined. With that in mind, it's a huge change that requires a proper process of change management. And I deliberately put there that 70% of change fails because it does. So it really needs everybody to collaborate and make an effort to execute this successfully. Next slide, please. This slide just is to emphasize really on country ownership, MOH, with understanding of the long-term benefits in the co-driving of the change with the procure. And this is really critical to make sure that everybody is involved. While it emphasizes on USAID, CDC, you can see on the bottom there, this was done for training for countries where we were talking about PEPFAR. However, it does not exclude any other funder, be it Global Fund or any other. If you want to embark on this, the process of collaboration is basically the same. Next slide, please. This is my last slide, and it shows a 12-month period that it can take to implement VMI from start to having the first 6 months and deliver some results. It took us longer to negotiate in Nigeria, and Theo is going to take us through the process. But the reason why I think it took us longer is because we also didn't know better. But I think with countries that want to engage this in future, we do have an orientation document that can be shared. And also we have a toolkit, as Jason has spoken about, that can be shared with information. And we can have countries interacting with other countries to learn lessons before they embark on making mistakes. With this, I'm going to hand over to my colleague, Dr. Theophilus Faruma from Nigeria, who have recently completed their 6-month journey of the phase 1 of VMI. Over to you, Theo.
Okay, thank you very much, Fazai. You've done very well. And good morning for those who are in American zone, and good afternoon, Nigeria and the West African. And then we are crawling towards evening in the East African sections. Thank you very much. All that Fazai had said is like you are in a chemistry class, and the teacher tell you if you take 2 molecules of hydrogen and 1 molecule of oxygen and you mix them together with the appropriate conditions, it should give you water. So that's what she has told us. So in Nigeria, we decided to take all this that she has said and see if we can mix this molecule of hydrogen and oxygen to give us water, which is the VMI we are talking about here today. And so just follow me as I take few slides to talk through what we have done. I'm just representing what the country entirely, with government leading, has done so far. In terms of background introduction, many of you know about Nigeria already very well. And just for the purpose of this, Nigeria has a population of almost 2 million people or more. And for the HIV burden in the country, is between 1.6, 1.8, depending on the data that you are looking at. So, but currently we look at 1.6 and then maybe 1.7 million people on treatment or recipients of care. And for this number of people, we are looking towards, the country is pressing towards meeting the 95 of the unit annually. And you know, the last 95 is the viral load suppression. And to be able to take care of this, Nigeria have, after the first diagnostic network optimization that was done in 2017 with the support of all the stakeholders, the government, and then with the supporting agencies, have been able to put in place 17 PCR labs that currently take care of viral load assays and EID in the country. And 6 of these, we call them mega lab because they have all that it takes to work between 12 to 18 hours or 24 hours, depending on the volume of samples that come to the place. And 11 of these labs have standard equipment installed all over. And with the DNO that was done in 2017, and to be able to feed this 17 PCR lab with appropriate volume of samples based on the service level agreement that we have entered with the vendors, we needed to establish the National Integrated Specimen Referral Network, which we call NISRIN, where sample can move from the spokes to the hubs or directly to the PCR lab in order to keep this 17 PCR lab running. And then with the benefits of service level agreement that we have had with the vendors that install the equipment in the country, we saw a lot of benefits, and just put some of them on the slide there for us to see that with the all-inclusive reagent rental pricing model, we had viral load testing equipment installed at the facilities for free, so that cost recovery will be done through the volume of reagent that will be procured. And that reduced the price regime of the price per test that we were doing in the country. Previously, I just give you an example that probably we're doing maybe $15 per test, but with the volume commitment we made, the price reduced to something less than $10 per test. And this created the healthy competitions between the vendors that have been engaged. It's no longer a monopoly where we are held by jugular by one vendor or the other. But with 3 of them competing heavily, we have a benefit of value for money that is being spent on these services. We also had increased utilization of equipment capacity, where equipment are not just idling. There was a time we did optimization in the country, and we saw that there were some labs that were even less than 20 or 30% utilized. But with the advent of the service level agreement, we saw that the capacity utilization increased greatly across all these 17 PCR labs. And that's helped us to eliminate expiries of commodity. I knew before the service level agreement, there was some time we were struggling to make use of the volume of reagent that were brought into the country, while some were stocked out and some facility were having reagent that were about to expire. So it took us time to be able to balance between expiry and stock out. And that also made available testing platform for patient care and then monitoring with ease. So irrespective of where the patient is located in the country, there is an equipment, a PCR lab that is close by that sample could be taken to for analysis. And I have mentioned earlier on that instead of outright procurement of this equipment, they were placed for free. So this was what we were enjoying before we began to consider vendor managed inventory. Why did we need to consider vendor managed inventory? Despite all of these benefits that we have had, we saw that there was a lot of reliance on donors projects, where we have insufficient human resources and structural deficiencies within the government institution. And then that created a heavy reliance on donors projects to sustain the supply chain. Already, yes, this is done and is giving us good benefit, but is the government leading that can sustain this benefit? And then the second thing considered was the lack of in-country stock holding. All of these region development commitment that we have made, we saw that it is when the orders are placed that these commodities are brought into the country, because currently none of this is manufactured in Nigeria. And because there's no stock holding in the country, sometimes the lead time between when order is placed and the commodities come into the country used to take long and creating a lot of service disruptions. We also saw that there were commodity imbalances across laboratories, where some facilities have more consumables than the other one, and then it helps us not accurately doing quantity to orders as it's supposed to be. And all of these things will say, okay, let's consider with the template that we have had, which Fazai had already presented to us, let's go and see what it looks like. And above all, we want to be able to sustain the benefits that we have already enjoyed with the service level agreement. That's what took us to begin to look at how to operate the VMI in the country. Next slide. Okay, so Fazai had already spoken a lot about roles and responsibility of stakeholders. So we needed to get the buy-in of every stakeholder that is responsible in ensuring that our VMI will be a success. And so from the government's angle, we have NASCAP leading the pack. And so they lead the stakeholders coordinations, including the key performance indicators review, lead biennial national quantification exercises that used to be done, and then as well as the semi-annual supply plan review meetings, also with the quantification team leading that process, and all from the government side. And with the government at the driver's seat, and then we could take all the other people as passengers and co-travelers along with us, which JSS-CPSM vendors and implementing partners are joining in this exercise. JSS-CPSM provided the TA to NASCAP in order to be able to do what they need to do in quantification, quarterly order confirmation, and purchase order placement were part of the responsibility given to JSS-CPSM, while we also review the proof of delivery and the process of payment for what have been delivered, as well as review the vendors' key performance indicators in collaboration with other stakeholders on a bi-monthly, quarterly basis, while the vendors have the responsibility of having stock, a warehouse in the country to be able to give us commodity each time we place order without a long lead time, and to also provide technical assistance to the labs on inventory management, and so that when they want to reorder, the quantity estimation will be easily done because they are there and seeing what is happening. And this leads to replenishment of commodities with ease, as well as if there are any shortage of consumable along the line, we thought that VMI should be able to meet this gap quickly. The monthly KPI review report should be submitted by them on the 15th of every other reporting month. And the partners and the laboratory staff who keep the inventory, the laboratory management information system data reportings are all that they do. So as you can see, everybody has something to do when it comes to vendor managed inventory. Next slide. All right, so what have we been able to do for this 6 months when we started to implement the VMI in Nigeria. Precisely March 1st was our start date for vendor managed inventory in Nigeria. So we work with the lab stakeholders, including the NASCAP, the quantification team, the laboratories, and other stakeholders to do what? We develop a scope of work, what will guide everybody, how VMI should be implemented. With a Gantt chart, the last slide that Fazai saw earlier on for that 1 year. So we have a Gantt chart on what to do at each point. And then the SOP for the first phase of the implementation was also developed. Government leading this and reviewing all that were put in place, and with other stakeholders and the vendors and others, also dotting the I and crossing the T's of the SOPs and the scope of work. We conducted the survey to take inventory of the basement of the commodities that were available before the start of the VMI. And that was in the first quarter of June 2024, and the pilot ended in September. So the report I'm going to give you in the subsequent slide was what happened from March 2024 to September 2024. We reviewed the January-February LMIS data and generate the March 2024 last mile distribution order and updated the forecast and supply plan, and then got all the commodities that's required when the orders, the purchase order were placed. All in all, we placed about 8 purchase orders for these pilots that we did. Next slide. Okay, so now we want to see what we did, our expectation, what is in the scope of work, and what was implemented, and if there are any consequences or implications that exist between our plan and then the implementation. Number one, we have quantification there, which is where we start from to know the quantity of commodity that is required by each of these labs. By the way, we started the pilot in 3 of our mega labs, which is manned by one of the vendors. We didn't want to put all our eggs in one basket. So we're testing the water with one leg first, and then let's see what happens before we take the next step. For the quantification, it was done and it was implemented as planned. So there was no any implication. Then for the order release, that was also done according to the plan. We realized that we need to use the min-max level of 4 to 9 months and liaise with vendors and releases the order as at when required. That was done, no issues. Then coming to import processes, PSM liaises with USAID to secure import duty exemption certificate, which is what for short we call IDEC waiver, and facilitated letters of authority, suppliers, ships, and then clear, and then to deliver. The first hitch that we hit was the delay in getting the IDEC waiver, and because the new government was also looking for a way of generating money from anything that is imported into the country. And so this falls towards the time where we needed to get this certificate, but it wasn't coming as at when we wanted it immediately. So that caused a delay in the first shipment that we got. Then there was supposed to be pre-shipment quality assurance that's supposed to be provided by the vendor. PSM will review and approve the shipping document. Suppliers occasionally ship commodity without a pre-approval. That was what we saw during the implementation, because we put in the SOP that before you ship, let us get the approval before you ship. But then we saw that a vendor probably trying to meet up with the time the shipment was done without the approval. And that related to the IDEC waiver and led to a kind of a demurrage that needed to be sorted out. Next slide. Okay, so at the lab for the resupply, we put down for the SOP that supplier is to calculate for reorder quantity of 4 months based on the forecast, and then validated inventory data that is available based on the bi-monthly CRIF report, which is the combined report requisition form, and then to be resupplied by the 2nd week of the odd months. And then supplier is also to share the last mile distribution order with NASCAP and JSCPSM and to notify the lab. What was implemented? You saw this, I put it in red, or I'm sorry, in a yellow, to show us that something actually did not go right with what we put on the scope of work. The agreed methodology for determining reorder quantity was not adhered to. And this often provided insufficient commodities in country to support resupply and delivery made to the lab without pre-notice and sometimes at odd hours. And the implication of this was that we had oversupply of some products and then a resupply not consistent with what we agreed in terms of timeline. And we also saw that we had multiple supply within one cycle. You gave a PO order, probably for example, for a quantity of 200, instead of delivering the 200 at the same time, maybe they were staggered into bringing 100 first, bring 50, and then bring another 50. And all of these provided a kind of inconsistency in reconciling the POD, and it increased paperwork. Then for the final one on this table is the inventory management and the reporting system. We agree that suppliers to support the lab to validate their reports before they are entered into the National Health Logistics Management Information System, as well as supplier was to deploy an inventory management solution, which was part of their agreement. But in terms of implementing this, we saw that the supplier conducted independent monthly physical counts and provided support in ensuring validated data. However, in terms of deploying the resources to support the lab, that was not done. And what we had, the implication of this was that we had unreliable data in the first instance for planning, and which brought risk of expiry for one particular commodity, the specimen diluent. Next slide. Okay, I'm trying to finish up our scope of work here. So we have also proof of delivery review and payment process. Of course, because when a supplier gives you a commodity, they expect to be paid. And to be paid, we need to review that, yes, actually what we requested for on the PO was received by the final destination. Supplier was expected to submit invoice and PODs with clear indication of the PO numbers. What we saw was that we had multiple PODs submitted within each cycle with each POD. And this reconciliation, this brought a reconciliation problem or becoming cumbersome to do. Then we had to also do inter-facility redistribution. This was put on our scope of work that if there's need for us to redistribute commodity from one lab to the other, this should be implemented. And actually, this was done as planned because we saw that when there was a little bit of a low stock in one facility, we were able to move them from the facility that have more of that particular commodity seamlessly. Thereby, service disruption was mitigated. And finally, this was one of the areas that we thought we could also maximize our benefit, which is replacement of control and consumable in short supply. For those of us who are in the lab space, sometimes you discover that you buy a pack of reagent that the manufacturer tells you is going to do 96 tests. And then there's a control that is provided to take care of that 96 tests. But one thing or the other happens within the lab that you need to use a control once again, maybe due to batch splitting or equipment outage, and then you still need to use the same control to restart the equipment. So that leads to shortage of control based on the quantity of reagent that is available at hand. So suppliers who was supposed to be replaced if any of these happen. But along the line, what we saw was that for positive control, negative control, and wash buffers, we needed to also buy more because the supplier say this was not what we actually intended it to be, based on the fact that they need to be paid for those ones. So the risk of testing interruption with stockout, consumable, and higher cost incurement because of per test will now cost more because you are using more control than is expected per test. Next slide. Okay, so giving a summary of all the rundown from all that I've said from those tables that I have discussed through, we have seen greatly that the government have taken ownership in terms of commodity management, procurement processes in the country. What this means for us is that even at the end of this project, the government already know how these were contracted, how these were planned, and what should be brought into the country. So there will be continuity and sustainability of VMI even after the project has ended. We have also seen that the Nigerian Health Logistics Management Information System reporting was sustained at 100%. So at every point in time, at every month that will require reporting, this was done. And we also saw that commodity availability improved because it was only one of the 3 labs that reported a stock out of a consumable, and which was quickly moved from another lab to them. And that was led to one of our staff in NIMA making this statement that before VMI, we used to have stockouts of reagent. But since the VMI started being implemented, we haven't experienced any stockout, which we think is a plus for the system. Let's see the next one. Okay, so there are challenges. I've already enumerated some of them while going through the slide. So just quickly, just to run through this, we saw that there was inadequate in-country stock causing multiple delivery within a cycle. And this impacted our IDEC waiver because once you use 2 IDEX or 3 IDEX for 1 PO, you are paying more, or you are using more of the amount or the cost or the volume of money that is on the IDEX instead of using it once. And we have also mentioned the IDEX related delays in shipment, shortfalls of control, high risk of expiry, especially for specimen development, which was not done based on the consumption initially. And then we also saw that there was increased level of effort for POD reconciliation because of the multiple delivery for one purchase order. And I think that should be my final slide, or one more time. Okay, so what are the lessons that we have actually learned? Should we discontinue VMI? Are there anything that we could do better after seeing this pilot that have been done? Yes, of course, there are. Government ownership and leadership are key to the success of VMI. So from whichever country or whatever organization that you want to do a VMI, ensure that the government ownership is paramount, because in terms of some waivers that are required, it's the government that can give you these leeways. Then streamlining the numbers of purchase orders and ensuring that each proof of delivery draws from only one purchase order, it will help to manage the additional paperwork and the level of effort that is associated with VMI. We have learned that, and we're going to continue to streamline that going forward. Procuring in test bundle rather than individual product will reduce paperwork and ensure a fixed cost per test. What we're looking at on this axis is that, is it better to procure per test or procure reagent the way they are in their bundles? But I think that going forward, if we can negotiate with the vendor that's, oh, I'm going to pay you by the number of valid result that comes out of your equipment, I think that way both parties will be more conscious on how to use the commodities that are available in each of the lab. Number 4, our lab should be resupplied based on routinely reviewed and updated forecast rather than the reported consumption, to avert bullwhip effect and artificial consumption. Yes, there could be artificial consumption at one point or other when bulk sample have been moved from one place to the other, and it is a one-off thing. If you want to use that figure of utilization to do your reorder level, you will see that you are going to have more than what is actually expected for that particular lab. And finally, scaling VMI to include other vendors who create a healthy competition and ensure that increasing utilization on any platform is performance driven. Okay, I mentioned that we have just done this pilot with one vendor, and we have 2 other vendors that are waiting on the wing. So we want to see what it look like if we take the whole of them together. But I believe one answer that I'll get at the end of the day is that we will get value for money. Finally, on my last slide, if there's still any. Okay, I've mentioned all of these, so I don't need to bore you down with any of these anymore. But one thing that I want to mention is that VMI is a collaborative approach with all the stakeholders that are in the lab space. This is where I pause, and then for us to see if there are questions that we need to answer or react to. Thank you very much. And back to you, Francis.
Excellent, Dr. Theophilus and Fadzai. Very expertly put out there, and I thought we just guessed right that it's going to be a fascinating session. Again, just to highlight a few things, better relationship between suppliers and buyers is almost a given when you go this route. And there is real-time pipeline information sharing because the supplier is actually embedded within your system. There is also simplicity and efficiency. You do not need to be holding stock that you need 12 months from now in your space. You can utilize that space to do other things and have that stock held for you by the supplier, and they only come in as and when you need them. And of course, it is also true that VMI does not address all supply value chain challenges. And so some complementary initiatives have to still be running alongside this very nice concept that is being provided out there. And then the last bit, which is the journey that Nigeria has gone through in putting 2 molecules of hydrogen and 1 oxygen to make water, is that what Dr. Theophilus brought out. Again, very, very expertly put there. And so, colleagues, it's now time for us to get to some quick questions and comments. And I have seen a few in the chat, and also they are being addressed by our colleagues from both the Nigeria team and then the PSM team. Now, this I'll throw it to Fadzai on the feasibility of running the VMI at national level versus at individual lab levels. And so is it, would you kindly just unpack for us, is this an initiative that can be run at individual lab level, or for now it is most suited when run at the national level?
Thank you, Francis. So as we know that at this stage, a majority of it is really at individual lab level. Mozambique tried it on 1 lab as a pilot, and Nigeria tried it on 3 labs with 1 supplier. But as we are speaking right now, Nigeria is in the process of wanting to engage 2 other suppliers with several labs. So it is a very scalable process. And based on lessons learned from the pilot, we, however, advise that countries start with a pilot and learn rather than to go full force into it at a country level.
Interesting, interesting indeed. And let me just hold it with you one more time. And just on the aspect of 1 supplier, 2 suppliers, multiple suppliers, kindly confirm 2 aspects to this. The first is, are we using suppliers interchangeably with manufacturers? Or are we speaking to vendors that can actually be pulling multiple suppliers together that they represent, so that you may not necessarily have the need to deal with so many parties when implementing VMI? What would be, as you're beginning to learn this from the few pilots that we're seeing, what would be some of your guidance?
So based on the all-inclusive service level agreements we've got, it's not a one-size-fits-all. There are times when the supplier, the manufacturer, or the vendor, they are themselves taking it all the way to the lab. And there are times when they actually have a country representative. In the case of Nigeria, the supplier is the one directly involved as a manufacturer or vendor with the whole Nigeria team. In Mozambique, however, the supplier is doing this through a representative in the country. So depending on whatever agreements the vendor or supplier or manufacturer has got and arrangements that they can make to make sure there is enough stock in country. It can be either way. It doesn't have to be one vendor bringing in suppliers, because remember, there is also privacy that is associated with information. So I don't see suppliers ever coming to one vendor in country or representative and doing this through one. But there will always be either a direct relationship with the supplier, manufacturer, or vendor slash, or it will be through a representative in the country, whoever they choose to be their distributor or representative.
Great. Jason, let me get to you as I give Fadzai some time to recover. So the aspect of the benefit to the supplier, because I think Aziz is indicating, or not Aziz, but another colleague, is indicating that a huge responsibility is being moved from the routine supply chain teams within our entities, ministries of health and labs, and we're moving that responsibility to the suppliers and the vendors.
Yes.
What is it that they're benefiting from this?
That's a really good question. So I think one of the aspects, obviously, is continuity of testing, right? So there's more testing, more products used, more money for them to be made in that space, right? If they keep the machines operational, these are some of the things that we've actually seen as part of SLA implementation with service and maintenance, right? If a machine is down, it's not consuming product. And then product availability also limits, the money aspect on that side. I think that the bigger push on our side is to create kind of a competitive market for additional service offerings across manufacturers. So I will be very excited when we have another vendor in the space. Right now we have one. When we have another, I think it's going to be a very competitive service offering that countries could potentially tap into. But I think the bigger thing for us is as we look at the current supply chain systems in many countries, it's operated usually through public funded and supported and donor-driven activities. And we're looking for these manufacturers to leverage a lot more of the private sector approach and create efficiencies and cost savings. So there are expenses, obviously, in driving supply chain. We know that. And we're looking at potentially transferring that responsibility, but also the potential additional cost of doing that. And the motivation for us, obviously, is that we feel that private sector can offer more viable options and to create efficiencies with a fixed price. So it's a money generating thing for them, obviously, and with product availability and instrument uptime increased, it makes sense for them too. I would also argue, and we have one manufacturer that is kind of frustrated with a lot of the current practices around general procurement, supply chain delivery, and those sorts of things, and they're very eager to take on a lot more of the overall control of product availability in countries. So it's a very good question. I mean, I think it should be directed also to the manufacturers. I can't speak on their behalf, but that's what we're seeing. For us, there's motivation because we want to mitigate the risk of countries handling product, transfer that risk over to manufacturers, and if there's a problem, it's the manufacturer's fault, right? Because they're managing the stock. So excessive expiries is their problem. Those sorts of things. So yeah, hopefully that clarifies.
Great. Thank you. It does. Thank you very much, William. So just for Theophilus, one question, and it's coming in from Davy. And Davy, I think in Zambia, is asking why the lab directorate, I'm extending it to mean the lab directorate, but he doesn't seem to see a lot of the lab folks being mentioned in your presentation. And yet the ownership, country level ownership is key. So are we only dealing with the leaders at the Ministry of Health and leaving the technical arm of the lab directorates that should also be involved in this very elaborate process? So your experience with engaging the lab directorates, very briefly.
Okay, thank you, Francis, and thank you for that questions. I'm sorry if the lab directors were not mentioned as copiously as supposed to be. But in this pilot phase that we did, we engaged the laboratory managers, the director, the three places that we walked through. At NIMA, we have the director of PCR lab in NIMA. carried along in the meetings and in other sphere with their staffs, also joining us for every of the review that we did, and even including the quantification that we did earlier for their various lab. And when we're taking the baseline data for the inventory they have, they were all informed. And even before we began the process of the pilot, we brought all the PCR lab managers and their key staff to a meeting. So in a nutshell, all the lab managers and their key staff were engaged before we began the implementation. Francis?
Thank you. Thank you. Thank you very much, Theophilus and team. So we're getting towards the end of this, and I know that most of the questions are being addressed in the chat. So let me just bring it to an end by asking our presenters to give their parting comments. And I'll start with Fadzai. I'm told ladies first. If you could just give us your parting comments.
Thank you very much, Francis. I just want to encourage everyone, as medical scientists on this platform, we seem sometimes to just focus on what happens in the labs, but it is really good to open our minds and focus also on the strategic initiatives that are being introduced, including all service level agreements and the things that complement them to ensure that we increase on our efficiencies, especially in supply chain, because if we hope to conquer these epidemics, it is really important that we align with the innovations that are coming our way, and we are open to implementing and starting new things like VMI. But more so with VMI, I always say comes the data sharing, and I know that countries are reluctant on sharing data, but without using data the right way, it's very hard to get back and get far. And I believe that in our next session, data sharing VIPMAS is going to be the next presentation. So I just want to encourage everybody to be on this journey and not be afraid and focus on the microscopes and lab processing of samples, but to also focus on those aspects that make the process more efficient.
Great. I lose you, Fadzai, but I think you are winding it up. And so let me move it to Theophilus, just in 30 seconds, your closing remarks.
Okay, thank you, Francis. My closing remark is this. VMI, vendor managed inventory, is not a magic or silver bullet. Continuous improvements process is the key to getting the value for money. Thank you.
Thank you very much, Theophilus. And finally, Jason, over to you for your closing remarks.
Yeah, so thank you for everyone participating, and I appreciate the comments in the chat too. I think one of the things that we're also trying to mitigate here is a level of responsibility for lab folks. I mean, if I was a lab manager and I'm working in my lab, the last thing I want to worry about is commodity availability. And if someone is dealing with that from end to end outside of my responsibilities, I think that is a true value add. Where I can focus on more lab operational challenges and other things potentially that I could be dealing with. So there's a definite value add there. Obviously, efficiencies and costs are a big factor, but in general, the intent here is to improve testing availability and ease at the lab end as it relates to commodity availability as well as, instrument operations. So thank you.
Thank you. Thank you very much, Jason and team, and also colleagues who've joined us. It is always exciting to have you with us, going through some of these very exciting sessions. This, of course, is one of those very, very important ones. We keep saying that without commodities, you do not have a program that is running. You need your commodities. And like Jason indicated, how to manage it, when to get them, whether they're going to be there or not, should really be the least of your worries so that you focus on some of the technical things. But we need to know what is in our environment, like Fadzai said, because you cannot implement your technical things without really paying attention to the environment that surrounds the implementation of those technical things that you're doing in the lab. So with that, we come to the end of today's session, and we look forward to again seeing you in our next session, which we'll be announcing very shortly. Again, another very exciting one. So from us, ASLM, we wish you the very best of your remaining part of the morning, afternoon, or evening, depending on where you're joining us from.